Okay, all right. Add it up.
Hello and welcome to In the Community. I'm Joe Dexter. Today, a very special episode as we'll discuss COVID-19 and its impact in our local community. Rockingham County Health Director Trey Wright will join us coming up in just a bit to discuss some of the situation. It's a very tough time for so many people out there, minus the fact of getting COVID-19, trying to get a vaccination at this point in time and figuring all the tough things out for the elderly population that some might be trying to help as well. It is a difficult time, and we'll talk to Trey Wright about what the health department is doing to try and ease that pain and some of the work that the health department is doing with the vaccinations, as that will come up here in just a bit. But first, let's take a look at the local numbers and the local impact on COVID-19 has had on our community. Across the Tar Heel State, 739,500 cases have been lab confirmed with 9,046 deaths. Let's take a look at local statistics updated today. 6,136 lab confirmed cases, up 34 from Thursday, and 73 deaths, up 4 from Thursday. 91 remain hospitalized. 27% of positive cases are full recoveries, and 70% of confirmed individuals are at home and recovering. Here's State Health Director Mandy Cohen talking about the current trends across the state when it comes to COVID-19.
On this first graph, we look at people who have come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. And you can see when looking at that yellow line, it has trended downward over the past 2 weeks. However, you can also see it is still well above where it was earlier in the pandemic. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March of last year. Like the previous metric, this still is way too high, but has been decreasing since its peak on January the 10th. If we narrow in on the trajectory of cases from early December through today, you can see a clear picture that our cases are starting to level, and they're back to where they were in late December. Next, we look at the percent of tests that are positive. This graph also goes back to the beginning of December. Looking at the yellow line, our percent of positive tests is leveling at about 10 to 11%, but this is still well above our goal of 5%. On our next graph, we look at day-over-day hospitalizations. This graph also is from early December, and you can see looking at that yellow line, this trend has decreased just slightly, but we're still well above where we were in December. Okay, so in summary, here's where we are. Surveillance data has decreased, but remains very high. It does get a red X. North Carolina's trajectory of cases is leveling, but still well above where we were most of last year. It gets a red X. North Carolina's trajectory and percent of tests returning positive is leveling, but is well above our goal of 5%. This also gets a yellow line. And North Carolina's trajectory of hospitalizations is leveling, but way too high. It gets a yellow line. The overall takeaway is that we are past the spike from the winter holidays, but we are still experiencing worrisome levels of virus. This worry is compounded by the fact that we now have a new, even more contagious COVID virus strain in our state. The 3 W's are as essential as they have always been. Remember, people can have COVID-19 and not know it. The best way to protect those around you is to act as if you have the virus and could be contagious. That means always wearing a mask over your mouth and nose, always waiting apart from others, and always washing your hands frequently.
Now joining us is Rockingham County Public Health Director Trey Wright. First of all, Trey, welcome to Rockingham County. It must be a crazy time to join the staff here with the things going on in our world, but we're glad that you're on board, and we look forward to getting to know you a little bit better.
All right. Thank you. I'm very happy to be here. It's been a
Very exciting. I will say, looking at the calendar, almost 60 days now. My first weekend here, we were already prepping for vaccination distribution. So definitely trial by fire, as I say, leaping right into it to try to get these vaccines out as quickly as we can.
Well, let's start there. Over 6,100 active cases of COVID-19 here. A majority of those active, about 70%. The vaccination process, you already have filled up on the next vaccination. Talk a little bit to us about that process and getting people vaccinated.
Yes, we had just opened up today. We were able to receive an additional 800 doses for next week for first dose allocation. We started our registration system today, both online and via phone system at noon. And in about 11 minutes, all 800 slots were filled. Very exciting, but also disappointing because I want more allocation so I can fill more slots and get those shots into the arms of people that want the vaccine. We've been working hard at that. Unfortunately, this past week, we did not have enough to have a clinic, but we keep advocating to the state level, to DHHS, that we can do more with more vaccine. And I think that's being heard not only here in Rockingham County, but other counties across the state.
What would your advice be, and maybe some words for those folks that are having a tough time? I'm part of the Stokes Rock Caswell Relief Network on Facebook, and many people have said, this is my 100th time trying. One person said that they tried to call today 141 times and couldn't get through. What would your message be to those folks, and what can they do to continuously better this chance? I mean, it's a hard place to be in right now.
Yes, my first thing is patience. We learn with each opportunity to provide vaccine what we can do. We're going to, and it's tough. We have the website. I've noticed that the web registration goes much quicker than the phone registration. To help those that cannot access the web-based registration, we're opening up. I think we're going to double our call center operators next week to allow for that. But still, it's not going to be enough. We're going to continue to try to do this because not everyone can access the internet. And I know other counties are just going ahead and registering, but they may not have the vaccine. I've heard this past week, tens of thousands of appointments across the state had to be canceled. That's tough too. We had looked at it in our leadership to register as we know, so we can guarantee that vaccination and not have to do a cancellation. But just please be patient. We're going to continue to ask for more and try to fine tune the registration process, whether it be via telephone or through the website.
With the active cases and the 6,136 total cases, what is your advice to the general public as we see some increase? A good portion have recovered, but 70% have not.
Yes. That even though we have the vaccine, COVID-19 is not taking a break. We're still trying to get folks vaccinated. But the three most important things we can do, we hear it all the time, is our wear a mask, wait 6 feet apart, wash our hands, please stay steadfast to the calls. Those three things have helped dramatically. I've noticed I reached out to a colleague and they had their first flu PCR test at the hospital because outside of COVID-19, this is helping us with other respiratory illnesses as well. I would think usually we hear folks, even myself, having at least one cold during the season. I've been very fortunate, knock on my desk here, to have not. So please stay steadfast to the calls. That's going to help slow the spread of COVID-19, just our 3 W's, and being cognizant of that, particularly in the cold. We don't be outside. We're much closer in the home to others that I say that are maybe outside of our bubble, and that's where some of the spread can come from.
The wear, wait, and watch approach, it seems a little elementary. Wear a mask, wait 6 feet apart, and wash your hands. It seems elementary, and at some point it feels like I've heard it 1,000 times. Are there different initiatives that the county are working on too to kind of spread the message of how important it is to follow those 3 W's?
Yes, our county PIO, we have worked with some of our leaders spread that message. So you're not just hearing it from the health director, but others in the community in different scopes and walks of life, that their reason behind it. As of now, too, we're starting a campaign on Know Your Spot, Take the Shot, and each of us and our reason to receive the vaccine when we can. But it's very important, regardless, and not just the health director, but other folks, that the community hears this as well.
He's Trey Wright joining us, the Rockingham County Public Health Director, asking your questions as well. So feel free to leave those in the comments as we discuss this COVID-19 and its impact. 73 deaths. It's tough to muster. What can we do besides? It's hard to ask because 73 deaths means a lot. I mean, I guess that would tell you the true impact that this can have.
Yes, I look across the state, but these 73 deaths, these were someone's mother, grandfather, grandmother, brother, sister, or cousin, and that's very hard on my heart. I have friends that I know that have suffered from this. I hear across the state, where I came from the East, that even, I think one was a principal that was relatively young. I think they were in their mid-30s. And had died, and the impact it did not only for the family but the students there in that eastern county as well. 73 deaths is 73 too many.
Absolutely. Recovering, we mentioned 4,317 recovering right now. No asymptomatic cases. Do you find that interesting at all, or what is the case with current COVID-19 cases? Is it just something the asymptomatic tests are not being done?
If someone doesn't have, so if I'm not showing those symptoms, I'm less likely to get tested. In some of those cases that we've had the asymptomatic, I may have been a contact to a positive and had been several days out of that incubation, and then still follow up with a test. Some folks, I'll pick on my age, that if we don't feel sick, we won't go to a doctor. If the check engine light's not on, there's not a problem. So with that, you won't see the asymptomatic quite as much. But if there's someone that's been a known positive contact and they come from testing and they still don't exhibit after a certain amount of days, we'll see it pop in there. A lot of the reason I've heard people getting tested is because they realize they've lost that sense of taste or smell. I joke about it with myself. I use a lot of hot sauce and everything. So the second I lose that sense of hot, I have a bottle on my desk here. The second I lose that or that smell, that's going to be a big signifier for me, since I'm so attuned to spicy foods and being able to smell. I'd like to think I have a very acute sense of smell, but if that check engine light's not on, a lot of times people won't come for that test.
91 hospitalized. We don't have the major capacity of a typical hospital. What is some of the heaviness of that caused for our local hospitals, and are they feeling it right now?
Oh, certainly. I think at one point some of our smaller hospitals had to divert patients because their beds were full, and that's been a big scare across North Carolina with COVID-19, not only in the small rural hospitals, but even our larger ones. Do we have to open field hospitals? Because can a large hospital, small hospital sustain that many beds for a COVID-19 unit and still, what I like to say, operate business as normal? The traumas that come into the ED, the pregnancies, they still have some surgeries that are not elective surgeries. So how can they still sustain that business as well as isolate and care for those with COVID-19? And it's taxing, very taxing on every community.
He's Trey Wright joining us, the Public Health Director for Rockingham County on In the Community. Another concern that I've seen from friends and others in the community is the whole teacher aspect. I know a lot of the initiatives of vaccinations go through the state based on what age you're going to give them or who is going to be able to give them. Is there some push for Rockingham County, though, with kids in school to get teachers an opportunity to be vaccinated that may not be 65? Because it's almost they don't have a choice to show up. They have to be there.
Yes. Each phase of the immunization plan from the state, details who's in that group. And with the deeper dive into group 3, teachers are a part of that. So anticipation with that, we have worked closely with our school system. They're gathering a list of who wants to be vaccinated. So when they do open up to that group 3 and we have the allocation, we can partner with them and determine if we're going to do a drive-through or a satellite clinic at one of the schools or administration to make sure those that are willing wanted it. But until the state does open that, we're just gathering our intel to see who wants it, how many people, so we can be ready when the clock strikes 12, so to speak, when group 3 opens.
Just for perspective for those listening, how tough has this been on your department? I imagine you guys are taxed pretty heavily. I imagine 11 minutes and 800 vaccinations. The phone lines light up pretty heavy.
Yes. We won't have the official numbers on how many people, how many people called today. But I know last week when we were able to open 160 additional slots, in 30 minutes, the county phone system received about 10 or 11,000 calls just to hear. So with a call center of 5 to 10 folks, that's very taxing on them. But also our staff, where we are pulling our nursing staff to provide vaccinations and still run business as normal. There's state mandates that we still have to provide. People still get sick. Child physicals still must go on. Unfortunately, STDs are still a real thing, so we have to test and treat those as well. And also pregnancy, so we can provide that prenatal care or that clinical support to someone that may need it. So it's been, again, it's been taxing because we're having to vaccinate 800 people next week, 600 that first week, first dose on top of that second dose, and still have folks come in for these other services. And also, I didn't include dental. We're still having our dental clinic running operational during all this as well.
He's Trey Wright joining us, the Public Health Director for Rockingham County on In the Community. The other aspect of it that I find interesting, it's hard for you to kind of diagnose and see what's up next without knowing what's coming from the state, and the federal level is still all messed up, a little bit confusing. Some states have found different ways, though, such as Florida working with Publix to find a mass distribution site. Are those things that Rockingham County officials are looking at, or anybody else that you know of in this region and state?
Yes. Here locally, we're working with our health systems and trying to locate a geographic area that's not only large enough for the public, but also large enough for all 3 entities to work simultaneously to provide vaccinations. I am aware this is going to be a year-long, if longer, process, so there needs to be a fixed site that when someone says COVID-19 vaccine, I can say, oh, yeah, that's at such and such, which used to be the former store, and name the town. But we have been actively searching. I've looked at a lot of real estate lately to see what's big enough that can sustain the health department, our health systems, good parking, good locations, so we can have that running as long as it needs to make sure we get all the community vaccinated that wants to.
And I think that's an important part. Not only is the logistics of putting this together for the user difficult, it's also difficult for local health departments and state health departments still trying to diagnose what's going on and how to do it. I can't even figure out how to brush my teeth in the morning, let alone get so many people at one location, whether it's nurses, finding parking for it, and keeping it safe with guidelines that are in place that need to be in place.
We've had some great partnerships here in our parking lot where we've done the drive-through clinics. It's been fantastic working with our sheriff's department, the parole, our county maintenance, emergency management, so we can get that flow ready. Since the first clinic, that was a first come, first serve, to our more structured system. 2 weeks ago when we did the first run of the structured system with 400 doses in about 6 hours, and that's scheduled versus that long wait of traffic, it was flowing so well. I stopped and looked in the parking lot and people were standing, and that felt good to see people standing because we were going so fast. And based on that model, if we can get more vaccine, we can get more done in a day. but it wouldn't be possible without all these great partners we've had, from the traffic flow to emergency management, and our maintenance staff helping us put these tents in our parking lot, because we have to. They're big, and they have to drill through the asphalt to put them there. It's not just as an ECU pirate. It's not just a 10-bay tent. This is a full. This is a nice tent that cars can actually drive through to protect our staff from the elements, because it's not getting any warmer yet. And as everyone knows, this past week, we may face snow, we may face rain, so we've got to be ready for inclement weather that's not too bad, so we can continue on.
It's an evolving process every day. It has been since the start of this in January, and it continues to evolve. Trey, I wish you luck as you continue to develop plans and fight this thing for us, and I appreciate the effort that you and your team are putting in to keep us informed as well as provide what is needed. So thank you so much for stopping by in the community today.
All right. Thank you so much.
He's Trey Wright. You can find out more information about COVID-19 situations here in our community. All you have to do is visit rockinghamcountypublichealth.org or call 336-342-8140. That's 336-342-8140. Listen, I understand how frustrating it is, too, as a husband of a nurse who works in dialysis. I've seen it firsthand with her just trying to be able to get a vaccination as a healthcare provider. It is a very difficult time for all of us, but I would remind everybody to be safe, stay inside if you can, and protect yourself if you can at all times, and trust your neighbor and believe in your neighbor. That's a big part of it, is making sure that it's hard at this point in time to not have the trust, because we need it, and we need to work together to fight this. I know that sounds hippie-ish. I don't care. It's a big part of it, though, and I appreciate all those in the community that are making those steps to make it possible. Coming up next on the next In the Community show, I want to preview what we have coming up on Wednesday. Keith Gagnon is from Reedsville High School. He is a researcher with Southern Illinois University, and his team has helped find a new variant in COVID-19 over there in Illinois. So we'll talk to Keith Gagnon, a Reedsville High School graduate, coming up on the next In the Community. Until then, please stay safe, everybody, and have a great, great weekend.
Okay, all right. Add it up.